How do overlap syndromes affect autoimmune hepatitis? Imagine your liver as a busy city with different neighborhoods working together to keep everything running smoothly. Sometimes, however, the immune system gets confused and starts attacking parts of the liver, leading to autoimmune hepatitis. But things can get even more complicated when other autoimmune liver diseases join the scene, creating what doctors call overlap syndromes. These occur when a person shows features of autoimmune hepatitis, along with signs of other conditions like primary biliary cholangitis or primary sclerosing cholangitis. Autoimmune hepatitis is mainly a chronic inflammation where the immune system mistakenly targets liver cells, causing damage. On the other hand, primary biliary cholangitis and primary sclerosing cholangitis mainly involve injury to the bile ducts, which are tiny channels that carry bile out of the liver. When someone has an overlap syndrome, it means they have a mix of these injury patterns, making diagnosis more challenging. Doctors need to look at blood tests, liver biopsies, and clinical signs to figure out exactly what's happening. For example, autoimmune hepatitis often shows high levels of liver enzymes and immunoglobulin G, while primary biliary cholangitis might show elevated alkaline phosphatase and positive antimitochondrial antibodies. Sometimes, a person's liver tissue shows both interface hepatitis and bile duct damage, which confirms the overlap. The reason these overlap syndromes happen isn't fully understood, but it's believed that genetics, environmental factors, and immune system glitches all play a role. These factors can cause the immune system to attack both the liver cells and the bile ducts at the same time, leading to a more complex pattern of liver injury. Because of this, the disease process can be more aggressive than autoimmune hepatitis alone, leading to faster scarring of the liver tissue, known as fibrosis, and increasing the risk of cirrhosis or liver failure. Treating overlap syndromes requires a careful approach. Usually, autoimmune hepatitis responds well to medications that suppress the immune system, like corticosteroids and drugs such as azathioprine. But since primary biliary cholangitis is managed with ursodeoxycholic acid, doctors often combine treatments to address both parts of the disease. This tailored approach helps slow down liver damage, but responses can vary. Some patients might experience a more severe or prolonged course because of the combined injury patterns. Over time, the ongoing inflammation and scarring in overlap syndromes can lead to serious complications. The risk of developing liver cirrhosis is higher, and in some cases, the damage can progress to liver failure. Because of the increased risk of liver cancer, especially hepatocellular carcinoma, patients with overlap syndromes need regular monitoring. Early detection of any changes can make a big difference in outcomes. In summary, overlap syndromes make autoimmune hepatitis a more complex condition by adding other autoimmune liver disease features. This complexity affects how doctors diagnose, treat, and monitor patients. Recognizing these syndromes is essential for providing the best care, preventing severe liver damage, and reducing the risk of liver cancer. If you or someone you know has liver issues, it's important to see a healthcare professional who specializes in liver diseases for personalized advice and management.